Hello, it's Dr. Radley, family physician in St. George, Utah, and I am back to talk about the future of healthcare. And I'm not talking 50 years down the road, 20 years down the road. I just got asked a question by my son about, am I talking about government taking over healthcare? I am not going there. That's not the point of this particular video. The point of this video is to help people be a little bit more aware of how this current pandemic is not just affecting the economy in general, but specifically affecting our healthcare system. So I am a private physician. I own my own clinic. At the end of the day, the buck stops with me. And I take that responsibility with a great deal of solemnity. My staff knows that. They know that that is always first and foremost weighing on my mind about taking care of my people. I have amazing staff, and I am so grateful every day for the people that I get to work with and how much they serve and sacrifice. I'm going to give a little joke that my husband said to me before I came to start doing the recordings. And it's a little bit of a twisted joke. For those of you who work in healthcare, you know we all have a twisted sense of humor, so you can appreciate this. But the joke was, we have to tell them thank you for your service because we can't say thank you for your sacrifice because we know that you're expendable and that's what's going to happen. No, I know, not very funny with everything that's going on. It's made me think a lot about other people in our community who give every day in a similar capacity. Those of you, again, who know me know that my husband is a police chief. He's been in law enforcement for over 27 years now. And he gives every day as well. There's not a single day that we do not live with the possibility of him not coming home. And in having this pandemic take place and knowing the potential for us as healthcare workers to get sick is a very sobering thought. And with my kids, they understand that it could actually be both of us, because both of us will continue to be in the community throughout the pandemic. And when the rest of you may be home with social isolation, we will be out there on the front lines. And I appreciate so much all those who are in healthcare and in positions that they have to continue to be out there in the community and serving, because we need them out there working, such as our law enforcement, our fire, our EMS, our public utilities people, those who keep the power and the water and the internet going, because honestly, I could not be doing what I do right now if it were not for those services being present. So we've talked a lot about the immediate impact in the short-term future of this pandemic hitting and how bad it could potentially be. What you don't recognize is what's going on right now. So I get asked, are you crazy busy right now? And honestly, my volume in my clinic is down. People are afraid to leave their homes because of social isolation. Even though there's a very small volume of traffic into our building, and we keep our building, especially my office, as clean as we possibly can to reduce risk for everybody, people are afraid to go out into the community. And I understand, and I'm not asking them to risk doing so. That's why we're doing telehealth for those who are willing to do that. We want to keep our patients safe. That's always our first priority. But it's not just my clinic volume that's down. I can tell you that reports have been through a primary care between 30 and 50% of reduction in volume. Now, for those clinics who are part of a large affiliation or a large group, they may have enough revenue in reserve to be able to offset months of that kind of decrease in volume. But for small clinics or smaller group practices, that could potentially be catastrophic. You might have doctor's offices and clinics that may end up closing because of the financial toll that it takes in the course of this pandemic being in place. So there are grant programs through the stimulus that the president just passed that they can access, and hopefully that will help them weather the storm. We are also potentially going to need to be pulled to the front lines, meaning backing up the hospitalists and the ER physicians. And we have already been putting in on rosters for our local community hospitals, as well as through the state health department, other organizations, those of us who are willing to go and serve in that capacity. Again, if I'm not in my clinic doesn't make money, so I have to have another way to fund that. So this isn't about me. This is about what I'm seeing going on in our healthcare system currently today. When I first heard Intermountain, and I'm going to use Intermountain because that's who runs our hospital for my community, but this applies also to Revere Health and the University of Utah and any other large medical organization or system in our state and also across the country. I guarantee you this isn't just impacting in our state. But when I first heard that Intermountain was going to voluntarily reduce having elective procedures, as a business owner, I had a pit in my stomach. I was sickened by it because I understand the finances of a hospital. I've been chief of staff at Castview Hospital. I've been part of the medical board of physicians at Dix Regional Medical Center. I've been chief of the Department of Family Medicine there as well. And a large part of their finances comes from those elective procedures. And in those rural facilities, such as Castview Hospital or where Sherilyn is at Uinta Basin Medical Center, that is a huge impact. And I thought, oh my gosh, how are they going to be able to afford to do this? And then it went from doing elective procedures to we're not doing elective, non-urgent or emergent radiology or lab. And again, that is a huge volume of revenue for those facilities. And it's actually made me sick to think, how are they going to weather the storm? Even with them being a very large organization, I don't think they have enough to back that up. Not for months on end. And if any of you think this is going away anytime soon, I'm going to tell you that you will probably be in isolation for a couple of months. And hopefully by June, things will be calming down enough that we can start to get out to more active, regular behavior in the community. But unless we have a perfect curve and it peaks in mid-April and then starts to plateau out and drop off towards the end of middle of May, that's not going to happen. So you're talking about months of impact of revenue on our healthcare system. Not just my clinic, but in almost every clinic I've seen. Yeah, it is going to be scary, Sherilyn, for the basin. I agree. I was on a conference call with other physicians and the Utah Medical Association. I think it was last night. The whole week starts to run together. There's so much going on. And they were asking about how to get signed up for the roster to be called on for backup for that first line of hospitalists and ER doctors and wherever people need to serve. And I want to tell you how proud I am of the physicians in our community and their willingness to serve and sacrifice, even if it's volunteering their time to do so. It really is amazing to see how much people have stepped up to make sure that patient care comes first and foremost. And that's really on the mind of the medical community, is that we want to make sure that our people are taken care of. We don't want to see 500,000 deaths in our country. Chantel, yes, the truth is hard. And Delana, thank you. I love you. So one of the things I wanted to express to everybody in the community is, rather than waiting for the government to be our stimulus package, you are our stimulus package. And I'm going to explain what I mean by that in just a minute. But going back to the meeting with the UMA, there was a physician on the line who said, tell me how to sign up. I currently feel like my talent and time is being wasted. And that's what's happened with a lot of our specialists because of them cutting out elective procedures. Their clinic volume is down 50%. There's a vein clinic here in our community that I frequently send patients to. I tried to send a patient to them today to do an ultrasound of their leg, and they told me that they're closed, that they're doing as much televisits and virtual as they can, but they're actually really not even seeing patients at their facility right now because they're primarily an elective facility. So the physician that was on the call said, I'm an anesthesiologist. I work at a surgical outpatient facility. All their volume is elective procedures, so they've closed their facility for the time being. Again, we don't know how long that's going to be in place. That could be a couple of months. That could be enough to completely wipe that business out. So we gave him instruction through the UMA on how to sign up to start helping. And, physicians are ready to go as the wave comes on and is stronger. But again, if we can do anything possible in our community to try to help make sure that we have healthcare on the other side of this, we need to be doing that. And so I said I would explain what I mean by that. So first of all, physicians need to look at the stimulus package. If they haven't, that's going to be a top priority. But you as our patients are our stimulus. If we're even doing televisits in the same time and hours that I do normally see patients in the clinic, that's enough to keep my clinic going. I wouldn't need the stimulus. For those businesses that are primarily elective procedures, I don't know how they're going to do it. I really don't. So places may close, and that may be a major issue when this is done. The other concern that I have about where healthcare is going to be on the other side of this is what happens to all of us on the front line. So I have watched the news in Washington. I've watched the reports from physicians there, as well as in New York City, and they are overwhelmed and they are exhausted. There's a question on here, did other facilities and hospitals who do elective surgery shut down? Yes, it was a government order that they were doing so. So as I watch the reports out of Washington, New York, and these other areas, I see the potential for severe problems with mental health and healthcare workers after this. Anxiety, depression, PTSD. How do you go from one day fighting the battle and deciding who lives and dies if you don't have enough ventilators, and being completely heartbroken, and then the storm finally goes away, and yet you still have to do your shift next week because somebody's got to do it? And that's the part that I'm worried about. I'm worried about, we've already in our country recognized for years that we have a higher rate of suicide in physicians and healthcare workers. I'm worried that that's going to escalate. People will become despondent after this and what they've been through. It's no different than someone else coming back from war and the emotional turmoil that they've gone through. And I have major concerns about that. I wish I could say there's an easy answer to help with that part of it. The honest truth is there's not. And physicians have already been struggling with burnout, even more so the last few years, with all of the stress and burden that's been put on them by government regulation and quality metrics that we have to report to. And on top of that, adding this, and then if there's financial duress for healthcare workers, it's going to be compounded, and that is concerning. The other thing that was concerning to me this last week is a news article that was published against Intermountain Healthcare. Now, I'm going to offer disclosure. I do work for Intermountain Healthcare as a consultant. My full-time job is my clinic and running my clinic. I do a quarter time and off hours as a physician educator for Intermountain Health. So I do make money from them, okay? That has nothing to do with what I'm about to say. When I saw this article, I was actually very angry. Prior to this article being put out in the media, Mark Bryce-Sarker, who is the Chief Medical Officer for Intermountain Healthcare, who I happen to know and is a really good guy, and his heart is always in the best place, looking out for patients and providers first and foremost. He put out a video through their system basically saying we will be looking at physician and APP, that's nurse practitioner and PA, compensation models starting this next month and moving forward through June and possibly later. Now, I have worked as a full-time physician in the Intermountain Medical System, and I can tell you that the way the majority of the providers in their system get paid is on a relative value unit based system. So you get paid based off of production. They do have a component of quality. You have to meet certain quality metrics for their contracts as well. But the short of it is, if your volume declines, so does your paycheck. And when I saw the video from Mark Bryce-Sarker, being a business person and owning my own clinic, it was very clear to me what Intermountain was saying. They were saying, look, we know a lot of our physicians right now are under duress and stressed because of financial risk. And with your volume being 30 to 50% down, there goes 30 to 50% of your paycheck if we don't step in and do something about it. Now, to me, that was very clear what the intent was in the video. The article that was put out to the media, however, painted them in an extremely poor light, basically saying that they were cutting their employees' paychecks. And since then, their CEO, Mark Harrison, has put another video out addressing this and clarifying this. But no, what they're doing is stepping in and putting a floor so that their paychecks don't bottom out. They're saying to their employees, we will protect you and make sure that you don't make less than number X, even if your relative value units drop below that. Now, knowing everything I just explained to you about what's going on with healthcare and knowing the financial risks that they have been taking by doing what is ultimately right by our communities and for patients, that made me angry that that's how they got painted when I knew exactly what they were saying, and that they were saying from the very beginning, we're here to protect you and we're going to do that. So hopefully people will understand that message and not believe what they read in the media. I think that's actually a horrible thing that was done this week, given everything that they are putting on the line to be taking care of our communities, especially when they're one of our major healthcare systems in our state. I think that was pretty wrong, personally. So I just needed to get that off my chest. Sorry, that's been bothering me all week. So Allegra's husband is ICU nurse here in St. George, and he's working with COVID positive patients. Yes, we have several in our ICU here in St. George. And 2 nurses have been furloughed because of possible exposure. Yeah, it's unfortunate that our staff is being exposed. I was informed of another unintentional exposure to another physician this week. My daughter, I didn't realize, was listening when I was on the conference call in the other room. And tonight, as we sat down to dinner, she said, "Mom, your conference calls are very depressing." And I said, "Yeah, you're right. They are. Because it's the truth. We know what's going on. We know the potential of badness that's out there. And we see our colleagues being put at risk every day. And unfortunately, some people not making good decisions and going on furlough when they should and potentially exposing their patients, which also makes me very angry." So, and Allegra also says she has a sister-in-law who's in Tucson in family practice doc, and they were told by the owners of the practice that they would be taking a 60% pay cut for the next several months. Yeah, exactly. Instead of them stepping in and saying, "We're going to give you a floor that you're not going to be dropping below that." Imagine the difference of how she would have felt if she had someone watching out for her like that. So what can you do? Schedule an appointment. Most of the insurance companies are covering telehealth visits, some of them without a copay, some of them at 100%. If our clinic times were full with medically necessary appointments, which many of you could do for a medication check or a refill, we wouldn't need anything from the stimulus package because we could take care of what we need to with our clinic with just keeping the volume up, even by doing telehealth visits. But when people aren't willing to do a telehealth visit or they're afraid to come into the clinic, volumes will stay down. Things are going to not be great financially for the healthcare system. And again, I have concerns about where we're going to be on the other side. So I don't want to be an alarmist, but I don't think people see this part of it. The average Joe doesn't see what's going on in our economy. And it's not just healthcare. My son and I frequently have this conversation about what it's doing in general to the economy and the small business owner in general to begin with. You can drive down our main street towards our house and there's small business after small business after small business. And if they aren't working from home with the governor's mandate to stay home and stay safe, a lot of them have just had to close up their doors and they still have overhead to pay. They have rent and they have utilities. They still have insurance premiums. They may still be having to be paying their employees. It's not just us in healthcare. The economy will eventually replenish, will grow out of this. It will recover one way or another. It may not be as rapidly as we like, but we have to have healthcare workers to take care of the community on the other side of this. In St. George, we are already in a healthcare shortage. I still take new patients to my practice, which is a rarity in primary care in our area, because I recognize how bad the need is. And people will wait 3 to 4 months to see me as a new provider. That makes me sick. I seriously adjust every time a patient tells me that. It makes me sick because that is not what I want for my patients. But there's nobody else there. Everybody else has been full and been closed to new patients. And patients have no place else to go. So they're willing to wait 3 to 4 months to get in to see me. So we can't afford to lose more clinics and providers. You as a community need us to be there. We want to be there for you. So the best thing you can do is, again, share this, help people become aware, tell your friends, look, if you need a refill on your prescription, schedule a televisit. Talk to them about the condition that you need the refill for, have them send the refill for it, bill your insurance. Again, check into your plan, but insurances are, again, for a lot of plans covering televisits at 100%, some without copay and co-insurance. You can check on your plan, see what they're doing. But if that is the case, you can be the stimulus to make sure healthcare survives on the other side of this. So thank you for watching tonight. I hope that you have learned and you have knowledge, and knowledge is power, and this will help keep you and your family safe. and help us navigate through these tumultuous times. Sans shifting every day is something new. Allegra says she asked for an appointment tonight to help with her allergies. Allegra, that's awesome. That's exactly what we want to hear. So again, have a good night. I'm sorry this has gone on so late, and everybody out there, please stay safe.